we have to sacrifice stability for mobility, and vice versa.
Mm-hmm.
Right? So if there is increased stability, we will have less mobility. If we have a lot of mobility, we sacrifice stability. So this is where we will have less stability, more mobility. This is where we'll actually have more stability, less mobility. We're talking about quadriceps, four heads, quadriceps. One head, second head, third head, and right underneath we have another one, right there, intermedius. Only this head will actually attach the pelvis. So this is not actually the strongest hip flexor. The strongest hip flexor is this guy here. So psoas minor, psoas major, and iliacus as a whole we call iliopsoas. These three muscles, psoas minor, psoas major, iliacus, is the most important hip flexor. And this is in our practice again, so since we're talking about it, that's the one that's tight.
Yeah.
That's the one that's tight, and that's the one that needs stretching usually.
And something to keep in mind too, so say for example, a lot of people want to try and work on lower abdominal strengthening, you know, the lower part of the abs, so they do leg lifts. And they do it really fast. So they lift the leg up fast and they just drop the legs, lift the legs up fast, drop them. What you're actually working on there is that muscle, that iliopsoas. So if you want to actually work on your abdominal, lift the legs up, but then slowly bring the legs down. That's how you get that abdominal engagement.
Can I have a question here?
Yes, yes.
When you do a back bend, or for example, lying on your stomach and then arching your back, does you stretch those muscles as well?
Well, yeah, sure. Actually, well, she's talking about kind of like lumbar extension.
Oh, lumbar extension.
Yeah. Sure, of course, you will give a stretch. You'll get a stretch on it, definitely.
Okay.
You're talking about cobra, right?
Yeah, as well, for example.
You either go on your elbows or on your arms, kind of like that.
Yeah.
Cobra position, yeah.
Mm-hmm.
Sure. I mean, that's really the purpose, is to elongate. One side, other side's ellipse.
Mm-hmm.
Makes sense.
Okay.
I think the best stretch for if you want to target that would be that, getting it down into a lunge, making sure that core is activated, making sure the glutes activated, and moving forward through it. But you really have to demonstrate that one to the patient. You know what I'm talking about?
Mm-hmm.
Okay, so we're talking about this stretch right there. Can you see it?
Yeah.
Yeah.
Mm-hmm.
That's the one right there.
What's really important, you want to keep your abdominals contracted, and you want to flex your glutes as well. And you want to keep your spine nice and straight. You don't want to overarch your back, overextend, because then you're not really getting the stretch, and then you're going to hurt your SI joints. That's really important. So a lot of people with tight hip flexors, they'll have sore SI joints. So putting them into the stretch can be pretty tricky. So you really have to make sure they have that core engagement as well as that glute engagement when they do that.
I was actually doing this yesterday. Actually.
That's good.
Me too. At yoga.
So like a lot of my like hockey buddies, like they get into the stretch and they go down like this, right? But it's just like, look at how arched my back is. Like it's quite a bit. So what you want to do, get that core engagement, flex that glute, keep the body nice and straight, and just bend forward at the knee, and that's as far as I have to go. And I've got a deep stretch into that flexor. Yeah.
With this stretch, I know that everybody usually wants to go do something crazy like that.
Yeah.
You know, like really the point what he made very good. You don't really need that. You know, it's just that, just right there. Yeah, that's all you need, and you will feel it. I mean,
it's a stretch to help an issue, but it could end up making it worse. You know, so you have to be really clear on your instructions and how you're explaining it. Yeah.
Okay, we talked about, we kind of reviewed the anatomy a little bit. So once again, really write that down. Core muscles. So anterior, posterior, superior, inferior aspects. So anterior lateral aspect is going to be transversus abdominis. posterior aspect, multifidus. Primarily, there are gonna be other structures, but we're talking about major ones. Then inferior aspect from the bottom, the pelvic floor, and from the superior aspect, diaphragm, right? And diaphragm has to be very mobile, no fascial adhesions, nothing.
You can't. It's really important not to just focus in on one muscle when you're trying to target the core. The best approach is to target all of them, or as many as possible, because you want that activation. You want that full activation, that full strength. So I know he mentioned a lot of transverse abdominis as being like the anterior aspect. That is like the anterior aspect, but it's not by far the most important muscle there.
Yeah.
So I mean, by incorporating your obliques, your transverse abdominis, your rectus abdominis, your quadratus lumborum, all of them together form that shell. And it's really important to target all those muscles. I know a lot of trainers will try to target the transverse abdominis by saying, inhale your stomach, or try to bring your belly button in. That is like the worst thing you can do to strengthen your core, Yeah, it's not working
Okay,
anymore.
we are standing in a plank, so, and you're saying that we should not activate those abdominal muscles or something.
No, definitely activate the abdominals. It's the transverse abdominis, because a lot of people focus on trying to activate the transverse abdominis by sucking in the belly button.
Yeah.
And understand that. So we want to do pretty much the opposite. You want to kind of expand out and have those other muscles contracted, like the obliques and everything else, to create that pressure, to add to that spinal stability.
Well, the external abdominal oblique and internal abdominal oblique, though,
are
not really considered as core muscles, though. They're going to be considered more as global movers. They're the ones, because they produce more movement.
We don't want to target certain muscles. So, for example, a lot of trainers will try to target the transverse abdominis, and how they target the transverse abdominis is by sucking in the belly button. So bringing the belly button in this way.
We're talking about right there, belly button going towards, like
towards the
belly
spine.
Button right there.
Yeah.
Going posteriorly.
Yeah. And that's just something we don't want to do, because now you're actually causing the core to become weaker, right? So let's get rid of that.
Static contraction with neutral pelvis. That's it.
Yes.
Just to summarize, we really need to start every single movement in neutral pelvic position, where it's right in between anterior pelvic tilt, posterior pelvic tilt. One more time, let's read what that is. So this is anterior pelvic tilt. This is posterior pelvic tilt. We need to be right in the middle. That is neutral pelvic position.
You're eliminating chance of injury.
Exactly. Exactly. So that no matter really what you do, like you're doing bench press or whatever, I see like this. That's terrible. I mean, like I've seen this like like it's that's crazy. So you really like, and no matter what you do, you should start, like your starting position should be neutral pelvis, and we should fire inner unit first. Global movers are the ones that will produce all the movement. Major, like all these, we're talking about moving limbs, moving upper limbs, lower limbs. Those are global movers. That's outer unit. That's global unit. What Clayton was really kind of trying to, his point really was that it's not really like the most important thing to suck that belly button in. Yeah. It's really to keep your pelvis in neutral position and to fire that inner unit first, and only after that move your, no matter what that is, neutral position first, fire inner unit, and only then produce that movement. Correct?
Yeah, exactly. Yeah.
For the Pilates, we're talking, well, not just Pilates. I mean, it's really we're talking about any type of like movement therapy or really proper positioning. Doesn't really matter, like proper bench press, let's say. It doesn't really matter. You need to have
fucking brushing your teeth, seriously spitting it out in the sink, like any time there's deviation from that posture, from that proper posture, there's chance for injury. So I mean, you brush your teeth, you
Yeah.
kind of bend over straight out. With my back, you know, there's chance for injury. But if you keep that pelvis neutral, that back straight,